Hello everyone, my name is Tala Sam'an. I am presenting today an issue that Algerians elderly are facing nowadays. The Algerian parliament considers criminalizing placing seniors in nursing homes. After the criminalization of indecent speech in public places in Algeria, the Algerian parliament has once again sparked controversy with a proposal to enact a law punishing anyone who has abandoned or mistreated their elderly parents. According to An-Nahar News, a group of deputies in the People's National Assembly, the lower house of parliament, has initiated a new bill to protect seniors from abuse by their children, proposing penalties of up to 6 years in prison and fines approaching $500. The Algerian government has opened numerous elderly care homes and centers during the 1980s, especially in major cities, aiming to accommodate homeless seniors. However, these facilities have become centers of neglect, as many Algerians have described them, due to the exploitation by some disobedient children who have dumped their elderly parents there. Algeria's infirmary problem involves several issues, such as insufficient money, poor facilities, a lack of personnel, and poor quality medical care. Chronic underfunding of the healthcare system is one of the key causes of Algeria's current infirmary state. Limited government financial resources have led to inadequate investments in personnel training, medical equipment, and infrastructure. Consequently, many infirmaries have struggled to give patients the quality medical treatment they need and lack necessary resources. The issue is further compounded by staff shortages, with many infirmaries unable to recruit enough trained medical personnel, such as nurses, doctors, and support staff. This shortage has not only affected the quality of care, but has also burdened medical facilities and has led to lengthy patient wait times. Although Algeria has long struggled with infirmary crisis, recent years have seen a heightened burden that the country's aging population, rapid population growth, and COVID-19 epidemic have imposed on the healthcare sector. An all-encompassing healthcare reform program presents a viable solution to address the challenges facing Algerian infirmaries. This approach is practical as it tackles systemic issues rather than focusing solely on treating individual problems, aiming to improve the entire healthcare system. A key priority of the reform program should be to increase funding for healthcare resources, staffing, and infrastructure, particularly in infirmaries serving disadvantaged population. This would facilitate the expansion and renovation of current facilities, procurement of advanced medical technology, and the recruitment and the training of skilled healthcare professionals. The responsibility for implementing this solution lies with the Algerian government, particularly the Ministry of Health. However, collaboration with other stakeholders, including healthcare professionals, NGOs, and international organizations, may also be necessary to ensure the success of the reform program. This program has the potential to greatly enhance Algerian individuals' health and well-being by addressing systemic challenges and making investments in infrastructure, staffing, and resources, especially for those who depend on infirmaries for their medical treatment. In order to improve Algerian infirmaries, advancing gender equality, and enabling both men and women to participate in healthcare reform initiatives would be beneficial. This approach is workable as it acknowledges that many viewpoints and involvement are critical to successfully tackling the healthcare issues. Men and women can collaborate through community-based initiatives, advocacy campaigns, and volunteer programs to enhance infirmary services and facilities. By leveraging the skills, knowledge, and resources of both genders, Algeria can access a wider spectrum of viewpoints and information to create novel solutions and effect significant change. The practicality of gender equality in healthcare reform initiatives lies in its ability to improve decision-making processes, encourage creativity, and support inclusivity. Promoting gender equality and supporting healthcare reform initiatives would involve both men and women, as well as healthcare professionals, community leaders, activists, and volunteers. Consequently, Algeria can harness the full potential of its population to create a stronger and more resilient nation. The proposal to enact a law punishing those who abandon or mistreat their elderly parents has reignited debate in the Algerian parliament. One main issue facing infirmaries is the lack of sufficient financial support and resources, leading to deficiencies in staffing, medical equipment, and infrastructure. However, implementing a comprehensive healthcare reform program is a primary solution to address the challenges facing them. This approach focuses on systemic improvements rather than isolated fixes, aiming to enhance the entire healthcare system. Another key solution involves advancing gender equality and ensuring the participation of both men and women in healthcare reform initiatives, which ultimately leads to more inclusive and sustainable solutions for infirmaries. If these problems persist, Algeria may face significant challenges providing healthcare, social care, and ensuring long-term societal stability. What is the fate of Algeria's future if its own citizens abandon their parents? Thank you.